Welcome and thank you all for joining today's webinar. My name is Tina Papp and I'm here with Sarah Kirch from the Wisconsin Cancer Collaborative. During the webinar, feel free to use the chat box for questions and or comments, and we'll get started here. This month's topic is about the 2020 Wisconsin Cancer Summit and some exciting updates. You will be the first to learn about our new website, the 2020 regional meetings, and the 2020 Wisconsin Cancer Summit. We'll also be asking for your help and suggestions on breakout session topics and speakers for the 2020 Summit. This webinar will be presented by myself, Tina Papp, the Member Engagement Specialist, and our Program Director, Sarah Kirch. Before we get started, let's go over the agenda for today's webinar. Here's the agenda for today's call. Sarah will run through the exciting news about our new name, logo, and website. I will then give a brief overview of the upcoming regional meetings and the 2020 Wisconsin Cancer Summit. We hope to hear a lot of great ideas for breakout sessions at the summit, so please don't be afraid to use that chat box and unmute your lines during that time. Afterwards, we'll answer any questions and wrap up with our webinar schedule for the next few months. And I will pass it over to Sarah now.
Thank you so much, Tina, and thank you everyone for joining us today. We know it's a really busy time, and especially right now in the case of present events. And so we really appreciate it. In light of that, though, we will be keeping it relatively short. In the end, we are happy to have our resident oncologist on our team, Dr. Noella Conti with the UW Carbone Cancer Center, also a member of our steering committee, actually join us for a little bit and provide some updates on what COVID-19 means for cancer patients and things that people with cancer-centric organizations like ourselves, what we should be thinking about, and along with a few links and resources. They're limited at this moment, but there are a few that we'd like to share. And one exciting update, and as you have already noticed, is that we have a new name and we have a new logo. And if you haven't already heard, we're now the Wisconsin Cancer Collaborative, and we're reducing the burden together. Since 2002, the staff of the Wisconsin Comprehensive Cancer Control Program has worked to convene members of the Wisconsin Cancer Council, which has always been our statewide coalition of members and organizations working together to improve health outcomes for patients, families, and communities. And our work is crucial, but we realized our name was confusing. We even had a hard time sometimes internally. So as both the Wisconsin Comprehensive Cancer Control Program and the Wisconsin Cancer Council, we were two separate entities working towards the same important goals. But since 2019, our staff and our steering committee began the process of identifying a single name that would both capture the program and the council. In interviews and surveys throughout this effort, key themes quickly emerged in words like collaborate, engage, convene, and work together. Our new name, the Wisconsin Cancer Collaborative, captures these essential qualities. And our members have long relied on our ability to bring a wide range of people and perspectives to the table. And we're excited that the name Wisconsin Cancer Collaborative clearly communicates just that. So on March 1st of this year was the light switch moment where our staff and membership are now working together under a unified name, the Wisconsin Cancer Collaborative. And much of the information here, why is it changing, what's changing, what's staying the same, and what does it mean for members, can be featured on the frequently asked questions document that was sent out in various areas of communication channels and email and constant contact and direct emails from myself. So we have a new tagline, reducing the burden together. We think that simplistically really shares the effort that we're all doing as the Wisconsin Cancer Collaborative. And our new logo represents the diverse and interconnected ways of our members. Something that is changing is the policy roundup. Formerly called the policy roundup is now the policy review, and it was something that was sent out yesterday. The member affiliation, so there's no need actually to rejoin the Wisconsin Cancer Collaborative. If you were a member of the Wisconsin Cancer Council, you are now also a member of the Wisconsin Cancer Collaborative. So our mission, vision, and values continue to be the same, and staff and members will continue to work together to create a healthier Wisconsin by reducing the burden of cancer for everyone. And the Wisconsin Cancer Plan will continue to guide our work, offering effective blueprint for reducing the burden of cancer in communities across the state. We also are excited to say that we have a new website. We are grateful though that the URL has remained the same. So if you've got us bookmarked, don't worry, it's still www.wicancer.org. And the FAQ sheet, I believe Tina actually just inserted in the chat box for a link for easy access. So with all of that, we wanted to ask if there are any questions that any of you had about the new name, the new website, any questions at all, or for the sake of time, we had planned on actually going through the website a little bit, but I think we would probably prefer to keep some time at the end to talk a little bit about COVID-19 and what this might mean for cancer patients. So as you do navigate the website, if you notice any glitches, anything like that, or if you have any questions, just please reach out to any of us on the team. There is a staff page on the About section of the website that has all of our contact information. So feel free to reach out to whomever, whenever. We are really there to be a resource to you. So if you do have questions, feel free to unmute your lines or type a question in the chat box. Let's go ahead and just give it a couple of seconds in case someone's typing. We hope in the end that this has actually made things a little easier and more straightforward. And in the end, there will be fewer questions about who we are and who we work with and what does that mean for members, etc. So I think then I will actually go ahead and move forward. So something that I do just want to upfront acknowledge is that we are again monitoring this current public health emergency and realize that regional meetings scheduled in April and May, which we'll get into a little bit, we will be monitoring the situation. We realize that people are getting pulled into multiple different directions of our membership, and we acknowledge that. And we also know that there are considerable travel restrictions to protect the health of people such as cancer patients or, with other, health issues going on. So we're keeping an eye out for that, and we'll continue to actually collect registration. Registration opened, I believe, yesterday. And we'll do our best to just communicate out updates along the way. So thank you for your flexibility. With that, I'm actually going to pass it back over to Tina Papp, our member engagement specialist, who will be sharing more information about the important events in 2020. Oh, and actually, I'm sorry. Excuse me, I inserted a slide briefly about the Wisconsin Cancer Plan 2020-2030 because a lot of our events are actually all about the Wisconsin Cancer Plan 2020-2030. And it was originally shared that the Wisconsin Cancer Plan 2020-2030 would be released at the regional meetings in the spring. But after considerable conversation with the staff and steering committee, we believed that the regional meetings were actually a better opportunity to get a last wave of feedback from members and stakeholders on the cancer plan. The cancer plan is so comprehensive that there's a lot of different pieces of information that everyone has different perspectives and expertise on. So we really thought the regional meetings, instead of rushing things or using that as a jumping off point for action, that would actually be a really great opportunity to make sure that the regions of Wisconsin felt and saw themselves in the cancer plan. So with that said, the Wisconsin Cancer Plan 2020-2030 will be in draft form, made available to participants of the regional meetings to provide input during the meetings, and then eventually begin discussions on how organizations and regions might begin to take action. The feedback generated from regional meetings then will be incorporated in the Wisconsin Cancer Plan 2020-2030 for an official release tentatively scheduled for August. And then the summit in October will feature a broad theme highlighting important components of the cancer plan and opportunities to take action. So now I will actually be passing it over to Tina to talk more about the events coming up.
Hi, everyone. I'm just going to do a brief update on some of the exciting events coming up and what you should add to your calendar for the spring and fall. So starting next month, we are going to kick off our regional meetings. These meetings are free to attend, and you are welcome to attend one or all of them and bring whoever you'd like as well. Like Sarah had mentioned, we are monitoring the developments surrounding COVID-19, so please just stay tuned, and I'm sure we will be sending updates regarding regional meetings and anything surrounding that. The locations that we have for regional meetings are Madison, which will be hosted on Thursday, April 23rd, hopefully. Milwaukee on Thursday, April 30th. Eau Claire on Wednesday, May 6th. La Crosse on Thursday, May 7th. Minocqua on Wednesday, May 13th. And Green Bay on Thursday, May 14th. Like Sarah mentioned, registration is now open, and you can view the chat box for the registration link as well. Our regional meetings will take place from 10 a.m. to 2 p.m. and our agenda will roughly follow this outline. Networking during registration and over lunch, a review of the Wisconsin Cancer Plan for feedback, a presentation of a local success story in each region, and discussion about how participants can begin to take action. With that being said, I want you to open up your calendars now and add a save the date for the 2020 Wisconsin Cancer Summit as well. This year's theme is Wisconsin's Blueprint for Action, reducing the burden of cancer for everyone. Given the new Wisconsin Cancer Plan, we want the summit to serve as a jumping off point for our members and stakeholders. The summit will be held on Wednesday, October 28th and Thursday, October 29th. Wednesday will include a pre-summit reception and awards ceremony in the afternoon and evening, and Thursday will be a full day of learning. There'll be an opportunity to highlight best practices, emerging issues, and innovative ideas on how to take action, as outlined in the new Wisconsin Cancer Plan. It will include a combination of general session presentations, breakout session presentations, and ample opportunities for networking. Before we jump into our feedback portion, here are some of the current topics identified and preliminary explored ideas. Some of our general sessions will include an invite that we have sent to Dr. Lisa Richardson, who is the director of CDC's Division of Cancer Prevention and Control, to highlight the national importance of our work in Wisconsin. A panel of Wisconsin's Cancer Center directors talking about the organization's commitment to the Wisconsin Cancer Plan 2020-2030. And a personal story highlighting humans at the center of our work, survivors and co-survivors. Some of our breakout session ideas have been discussed, and they include patient navigation programs in our state to increase cancer screening, the Medical College of Wisconsin's Lung and Breast Cancer Disparities Initiative, future of cancer care, innovative cancer treatments, exploring data gathered through Wisconsin's initiative to address rural cancer care, policy topics including medical marijuana, cancer clinical trials, and tobacco, healthy eating, and active lifestyles to reduce cancer risk. At this point, I want to see what other ideas you have to suggest and some topics that you would like to possibly see at the summit as well. So please don't be afraid to put anything in the chat box or unmute your lines and let us know what you'd like to see at the summit. Does anyone have any thoughts or suggestions on the current breakout sessions that we have listed? Or speakers for possible topics from these breakout sessions? I see Lisa Albright has mentioned removing barriers to cancer screenings. That's a great idea, and we'll definitely add that to our list. Do you have any possible speakers or organizations that we could possibly contact for this breakout session? Data gathered throughout Wisconsin was also one that was talked about highly in our steering committee meeting, and I wanted to see what everyone thought about having a breakout session on data as well. I see Sherry Scott also mentioned American Indian Cancer Foundation for cancer screenings possibly. And then Lisa, you also mentioned that you have said that this interest our population is something you struggle with. Well, we can definitely look into some speakers or organizations that might have knowledge in cancer screening. Hi, Deborah, thank you. We will write Gina's name down. Hi, Sherry. I see that you mentioned the hotspot maps on cancer. That's also a great suggestion. Thank you. Bear with me as I write down a lot of these suggestions and notes. Okay. Does anyone else have any feedback on breakouts?
Can you hear me? Or
Yes. Who's speaking?
Hi, this is John with No Stomach for Cancer.
Hi.
I'm actually on my mobile device, so I'm not viewing the meeting online right now. So just wanted to ask if there's a potential for a breakout session for participation in registries.
Participation in data registries?
Yeah, patient registries, correct.
That hasn't been brought up, but we were making notes of everything.
I think that would be a benefit, and it depends on the audience, you know, for these breakout sessions. If they're going to be mainly professional breakout sessions with the medical community, or if there is an opportunity for patients and caregivers to attend. If not, it may not be appropriate, but I think the conversation is probably worthwhile.
Sure. Are you speaking specifically about the Wisconsin Cancer Reporting System, the cancer registry at the state, or are you thinking about other different population registries?
Yeah, I think disease-specific registries, based upon the members, the membership registries. I know we have our own registry that we're always trying to build, and I'm assuming others as well. Others do.
Sure. Sounds good. Thank you.
I also see that Suzanne Garcia-Franz mentioned in the chat box any new data research on PFAS and plastics in our water sources on cancer incidence rates. That's also a great idea. Thank you.
Sarah, or Tina, this is Noelle LaConte. The UW also probably would be interested in participating in the registry idea because we have the Molecular Tumor Board Registry.
Okay.
And we also have done post-approval registries for new chemotherapy drugs. So I think that could actually be a really interesting breakout.
Yeah, and I think it kind of goes to the mission of the overall collaborative too, lessening the burden, and there's two big parts of that. One is prevention, or three really big parts: prevention and early detection, and then of course gathering of data in order to move the ball forward in research, and registries play such a huge role in that.
Definitely.
Yeah, registries are brought up a few times within the Wisconsin Cancer Plan draft, actually, so that could be really interesting. And Linnea from Gilda's Club mentioned that the Cancer Support Community's Cancer Experience Registry could be another piece of that puzzle that we're talking about. Thank you.
Does anyone else have any ideas or suggestions or feedback for the summit? Well, feel free to contact myself, Tina, or Sarah if you do have any suggestions on breakout sessions, speakers, organizations that we should have attend or speak during the main sessions and breakout sessions. Our emails are located on our website, so don't hesitate to reach out. With that being said, I'm going to go into our upcoming webinars. Don't forget to register for next month's webinar on alcohol and cancer risk. That will be held on Thursday, April 9th at 10 a.m. We will not be hosting a webinar in May due to regional meetings. It's going to be a busy month for everyone, so please attend a regional meeting if you can. And lastly, we are now introducing a membership orientation webinar for new members and organizations. Even if you are not new, this webinar might be helpful to understand how you can best utilize your membership. We hope to routinely share membership orientations into the future as well, and that will be held on Thursday, June 11th at 10 a.m. So please register for that as well. You can register for all of the webinars on our website, so feel free to go to our website and click under events and go to webinars, and you can register for them there and see a brief overview of the webinars that we have and all of the recordings from previous webinars. With that, I'm going to turn it back over to Sarah.
Thank you, Tina. Yeah, absolutely. So thank you again for participating in this. We don't even have a slide prepared for this, to be completely honest. We decided to add this morning. But as we've been trying to track COVID-19 ourselves and think about our own work as it interfaces with regional meetings, and our partners get very busy with their own responses and emergency preparedness plans, we've also been trying to sift through as much as we can when it comes to cancer patients and COVID-19 and what it means for them, and things that organizations that are members of the Wisconsin Cancer Collaborative can perhaps be considering and thinking about, or perhaps sharing with their constituents. So I'm actually going to pass it over to Dr. Noelle LeConte, who's a medical oncologist with the UW Carbone Cancer Center, to share a few words and probably open it up for any questions that we can hopefully answer.
Thanks, Sarah. I thought I would just make sure that we're all kind of on the same page here. And then I'll go through kind of my sort of top 3 points right now for cancer patients. And then we do have some articles and things for you to do a deeper dive if you want. So COVID-19 is the name of the variant of a coronavirus, which is spreading rapidly across the globe right now. It's now considered a pandemic. Coronaviruses have been around for a while. You know, the most common one would be like the MERS or the SARS virus. It's distinct from influenza virus. It is not influenza. And it is a very novel virus in humans, which is why pretty much nobody has innate immunity to this. Unlike influenza, we don't have a vaccine or treatments for COVID-19 at this point. Right now, there is a promising antiviral, which is in clinical trials. So a patient would need to be able to access that trial treatment. And then there are a lot of anecdotal data, but there's not a standardized like Tamiflu for influenza at this point. And a vaccine, which would likely bend the curve on this virus, is probably a year out or so, realistically, just with what has to happen to develop a virally targeted vaccine. So having said all that, COVID-19 is in the United States. It is likely to spread much wider in the next couple weeks. Estimates are that about half the U.S. population will be infected. It does seem to affect children not very seriously, but they can serve as a reservoir for infection. And then as people get older or have more illnesses, they're much more likely to have a serious variant of this, which manifests with very severe lung disease called ARDS. Cancer patients in particular seem to do very, very poorly with this virus. And then patients with heart disease, maybe hypertension, and maybe diabetes also seem to do poorly, although cancer patients are at the top of that. They do the worst of that whole group. We don't know if cancer patients are more likely to be infected. We don't really know too much about who's more likely to be infected. We know the virus is, at this point, seems to be surviving about 3 hours in the air and 1 to 3 days on a surface. So if somebody coughs or sneezes and you walk through that airspace, you could potentially acquire it, which is partially why we think it's spreading so quickly. So it is here, it is in the United States. We continue to think that social isolation is the best strategy. Socially isolating healthcare providers so that we have a workforce when the virus hits in large numbers, but also socially isolating those who seem to be at most risk of serious complications like cancer patients and people over 60. Diabetics, maybe people with heart disease and hypertension. Social isolation means that you would be physically separated by 6 feet from family members and strangers, that you would avoid crowds. You would limit exposure to other people as much as possible. Lots of hand washing, like a ridiculous amount of hand washing, trying to avoid touching your face. And at the point, if you have symptoms, calling ahead to be evaluated. I think for cancer patients, and cancer doctors, this has pushed us to think about novel ways to provide care, including telemedicine, which has been something that we've been talking about but not really implemented. I think this may force our hand, so to speak. Drive-through or drive-up swabbing for COVID-19 through large cancer centers or even smaller ERs, that kind of thing. And then a so-called fever clinic, which is really what seemed to have been the curve in China, was rapid ability to evaluate a patient with fevers, checking people's temperature upon entrance to any building or their homes, and then rapidly isolating those people until they're fully ruled out and have eradicated or developed immunity to the virus. We do have 4 articles that I thought would be of use. One is written by an Italian oncologist, and his experience with COVID-19 is obviously very, very penetrant into Italy right now. He describes it like a war zone. We anticipate if we don't change things here in the United States, we will run out of ventilators and people will die due to lack of access to a ventilator, which is exactly what they're seeing in Italy. There's an article about the Chinese experience that just came out yesterday, trying to understand who is most likely to have a poor outcome. That's from The Lancet. There is a patient-facing article from the American Society of Clinical Oncology, which would be reasonable to share with patients or public, just about what can we do to help protect cancer patients. And then finally, the first report of COVID-19 pathology has been published, and it was actually in 2 lung cancer patients from Wuhan, China, that had a lung resection and unknowingly were infected with COVID-19. And so I think what we're starting to learn about this virus, actually, the first steps were probably made by cancer patients, which is, I think, interesting and important, but also speaks to the fact that this is largely asymptomatic for a very long period of time, which is why we can spread it so quickly. So those were kind of my talking points. I'm happy to take questions as best I can. I'm not infectious disease, but certainly all of us at UW Health are pretty much knee-deep in COVID-19 at this point.
Thank you so much, Dr. LoConte, for that information. We will, stay tuned to your expertise and do our best to share information out as we receive it as well. We know that this is an evolving situation, and hopefully more information will be made available as we learn more. Jillian Clark actually had a question about anything on social media. I would imagine maybe perhaps that cancer.net resource would perhaps be the best and most comprehensive. And so I would suggest that. We do not have anything that we've, reported out at this moment in time ourselves, but we'll probably just try our best to actually send information out and do our best to maybe translate as we can.
Yeah, I think CDC has really great resources that are not specific to cancer patients, but contain really solid advice about social isolation. We're coming right up into the spring break time for most of us here in Wisconsin. I think anyone that's interfacing with cancer patients or people over 60 really needs to think twice about spring break travel. So we've been sharing the CDC resources beyond that cancer.net article for our patients here.
Thank you. And Jerry Scott had a question about how long people are infectious after they have had it. I'm not sure if that had been yet addressed, there's also-
Yeah, we think they're infectious for at least 24 hours after their fever breaks, but what we've been doing is repeating their COVID-19 testing, and we don't call them eradicated until they clear that test, until they clear the virus. But we don't really know. It's looking like on average patients are hospitalized for about 3 weeks. But that could be a variety of things. That could be that they're still sick and they can't leave the hospital for that reason, or it could be that they're infected. We really don't know too much at this point.
Thanks for sharing a little bit about what we do know. Judy Hebel mentioned that the Wisconsin Department of Health Services will be having a Facebook Live event scheduled for today at 11 a.m. We just linked to the Facebook page for DHS there. Thank you, Judy, for bringing that up. For those of you, I would suggest attending that. Any other questions for Dr. LoConte or for anyone on the team or for anyone perhaps even on the call? We'll just wait a few seconds in case someone's typing. But I do think in summary, we had a lot of events planned in the spring, and we realized that, our needs and our health might be put somewhere else. And so just please stay tuned. We will do our best to communicate out with updates. In the meantime, please plan on registering to attend the regional meetings. And if we have to move to a more virtual setting, at least then we have a captive audience as to who we would plan on anticipating participating in a regional meeting. Again, this is moving quickly and evolving, and we will do our best to keep everyone up to date on those plans. And as you need information or have questions, please feel free to reach out. We might not have the answers, but we can find the experts that do. So with that, please, take time to do whatever you need for the rest of your 30 minutes. We ended a little bit early. We appreciate you all taking the time to learn a little bit about our new name, the Wisconsin Cancer Collaborative, our logo, and our website. Stay tuned on that website, wicancer.org, for any applicable updates. And we hope to see you soon. In the meantime, stay healthy and be safe. Bye, everyone.
Nice. Yeah, I don't know how that works, but it's off.
Frankly, he just frustrated me.